Statistically, approximately 8%, or 1 in every 12 adults in the U.S., have at least one knee replacement procedure in their lifetime. Knee replacement surgery is one of the most common orthopedic procedures performed today, and the number is growing rapidly. This video answers some of the most frequently asked questions about knee replacement surgery and the pain that inevitably comes with it. What is the average age for a total knee replacement? The average age of those having a knee replacement surgery in the U.S. is around 65 years old. Is knee replacement really painful? That's the number one question asked by individuals who have been told by their doctor that they need a total knee replacement. People have different pain tolerances, of course, and some people hurt more than others after their procedure. But most individuals who get the surgery have suffered years of severe pain from arthritis or other knee problems, and they'll tell you that the temporary discomfort, distracting though it may be, is worth it. Why is there so much pain after knee replacement? When you have a knee replacement procedure, the doctor cuts out damaged bone, cartilage, and ligaments, then adds an artificial joint made of metal and plastic. Obviously, that's a lot of trauma for your knee to deal with. So pain is normal after knee surgery, but it lessens with time. Today's knee surgery patients can get relief from prescription drugs, which are effective and often necessary. Once again, everyone's pain tolerances are different, and how long you need painkillers is an individual decision to be made by you and your doctor. How long does the pain last after a knee replacement? Expect some generalized discomfort as long as several weeks after a total knee replacement. You'll also have some swelling for 2 to 3 weeks, although in some cases it could persist for as long as 3 to 6 months. Bruising typically lasts for 1 to 2 weeks. How long does it take to walk after a full knee replacement? Unfortunately, it takes a while for most total knee replacement patients to walk on their own, maybe 4 to 8 weeks. To regain full use of your knee, you'll probably also need several months of physical rehabilitation appointments. This rehab can be uncomfortable, but it's necessary to help you strengthen the muscles of your knee and regain normal movement. What is the success rate of knee replacement surgery? There have been studies showing that 90 to 95% of total knee replacements are still functioning well 10 years after the procedure. Most patients can climb stairs and get up from a chair normally, and most can even resume a significant level of recreational activity. To learn more about a total knee replacement and the pain that accompanies it, click on the links in the description section for this video.